Repeating myself every time I go to a doctor or pharmacist is painful and expensive. Even in 2022, I have to recite my medical history to healthcare professionals. My girlfriend, who was pregnant with our twins, passed away mainly because of the same problem. I was forced to try to steal her medical records from 2 hospitals and a clinic in order to get a second opinion. Unfortunately, before I could implement my plan, she passed away. Patient data is fragmented in the healthcare sector and, as a result, duplicates the costs to the consumer. The Philips Future Health Index study discovered that South Africans spend the most money on healthcare for the least impact. Why do people have to die? Because we do not keep people's data in a safe, accessible, and consolidated manner. In order to give consumers this access, we can reach them through their smartphones, thus eliminating the paper and going green. The POPI Act demands that consumers have this access and say on how their data is used. I will attend to the independent pharmacies first. Users will be identified easily on their data on the pharmacy that they're working with and all other pharmacies. Our prototype has links to the Department of Home Affairs. Clicks and Discam do this through their Clicks loyalty programs and Discam loyalty programs, but patients do not have access to this data and they cannot use it anywhere else. Through chat, pharmacies will be able to upsell their consumers by accompanying them through their purchase journey. During the COVID-19 pandemic, some pharmacies had to use WhatsApp in order to communicate with their consumers. However, WhatsApp is not made for that purpose because the data is quite sensitive. When the transaction is concluded, payment will be made on the app and delivery will be made on demand. This will create youth employment opportunities for the populations. Our business model, pharmacies are going to pay us 500 Rand per month subscription, and they will sign up their consumers onto our platform. And then they will be getting a monthly recurring revenue of 10 Rand for the consumers that they've signed up. Consumers will no longer be hooked or locked down to one pharmacy. With a recurring revenue of about 1.8 million per month, pharmacies, we will be able to reach our target market, which are young mothers and expecting mothers. They will be paying us 99 Rand per month, but we want to do this through medical aids immediately so that the medical aids can pay for their clients, and then we can actually do the work. We have a digital prescription app, which was a prototype. However, we made the mistake of being dependent on doctors because we were focusing on only prescriptions. Therefore, the system couldn't move. Our pivot is to change the demand from doctors to come from the consumers. We got grant funding from the East London IDZ of 1 million Rand. We've worked with MedPrax. We have about $55,000 worth of credits from Twilio and Segment. I've completed my Thinkubate modules, and I've done an enterprise development program from AWS. This is my team. I've failed in business in 2016. I have Dr. Sean Elem with 16 years experience in software development, and Mr. Spanantla Penyana, who works at Mercedes-Benz. My ask, I would like to be introduced to these individuals, preferably at the same time. I'd also like to be part of the 8th cohort of the Grindstone Accelerator and a match funding of 3 million because there are interested parties that would love to invest into my company, which is the IDC, the Eastern Cape Department of Health, and the Spy Fund from the DTI. My name is Edumisa Mdoli, and I'm here to put a dent in the universe. I thank you.
Absolutely phenomenal. Right on time. Congratulations. Can you imagine going to any pharmacy and getting a prescription? I mean, absolutely fantastic. Great work there. I just want to see from our judges if you have any questions. You'd have 2 minutes to ask. Any questions? Okay, I will go.
This on. Can you just tell us about your user acquisition model? You're shifting your model from targeting doctors now to targeting consumers. Can you just talk us through this B2C model and how you're going to acquire those users?
Okay, so my focus is to go through pharmacies at first or through medical aids. Our mistake was that we created the prototype and gave it to doctors and with the expectation that the doctors are going to sell it to their consumers. However, they didn't do that because there's this fear that technology is taking over. So now, by telling the consumers that you own the data is yours, you shouldn't be at the mercy of a doctor. So that's why we are changing this demand to go to the consumer. We could do social media, but it would be easier if we go through the medical aids, and then we can actually acquire them. We could even work with the chain pharmacies when they see what we're doing with the independent pharmacies.
All right, happy? Another question over here.
Greetings. Given that the medical practitioner are still central to the patient and the other service providers that you would need, have you looked at any regulatory environments that may hinder your diffusion in terms of either where cases there could be doctor-patient confidentiality or maybe a third party requesting directly from a service provider and not necessarily involving the patient?
So can you repeat your question a bit? If I'm understanding you correctly, you're trying to say what are the regulations that we compliant to?
Yes, precisely because the medical practitioner is central to the transaction in terms of the patient having to consult a medical practitioner for their data to be, their latest health data to be available, a true definition of who they are, what they're going through, and the diagnosis thereof. Okay. So those type of regulatory spaces, have you looked into those?
Yes, we have. There's something called the Advanced Electronic Signature that we actually did with the Law Trust. There was a regulation from the HPCSA, so we were actually compliant in our prototype. There's also the POPI Act. But when we were doing our terms and conditions, we worked with a lawyer to consult on these consultant issues. He said that we should work on the GDPR, which is the international standard. So the draft is there. There's also HIPAA, which is the international standard. So basically, these are things that we are going to actually use this money for.
All right, a loaded question, a loaded answer. Thank you so much for that.
Thank you.